Over the last 10 years, there's been a rapid increase in the amount of people looking to recontour their lower bodies and, in particular, their buttocks. There are different ways to rejuvenate this area, and they involve the use of one's own tissue or the use of other tissue. In terms of other tissue, primarily this has been implants made with silicone, and then the techniques of using one's own tissue initially used to be the tissue nearby, using flaps and maneuvering fat above the buttocks into the buttock. And over the last 5 to 10 years, a rapid increase in the harvesting of fat and injecting that fat into the buttocks themselves. It is this that has been termed Brazilian butt lifting, and is the use of autologous fat from other areas of the body to inject into the buttocks. We now know that Brazilian butt lifting is highly risky, with mortality rates of around 1 in 3,000. And the reasons that this can happen are mainly due to the fat entering the bloodstream and lodging in the pulmonary system or the lungs, and also from DVT and pulmonary embolism. There are other risks, including lumps and bumps and irregularities that can happen, oil cysts, and damage to nerves around the buttocks. In terms of safety, it's very important that certain cannulas are used. The fat is injected in the superficial plane and not into the muscle. And patients need to realize that mega volumes and very large volumes of fat being injected is highly dangerous. In terms of results that can be obtained from buttock rejuvenation, and in particular Brazilian butt lifting, it's important to consider how the perception of the bum appears in relation to the waist and the thighs. If we look at this lady, she has some fat around the flanks and the back and the upper thighs, and she has some back rolls as well. All of these areas are amenable to liposuction, and by liposuctioning these areas and using the fat to enhance the buttock and giving her a buttock rejuvenation or Brazilian butt lift at the same time, with very small amounts of fat being injected, one can see in the post-op images how improved her buttock shape is, and in particular how the perceptual shape of the buttocks and the bum sit better in comparison with the waist and the upper thighs. In terms of the other techniques of using implants, these are decreasing now that fat transfer has increased, and it is illegal to inject any other form of chemicals, and in particular free silicone, into the buttocks, and there has been a lot in the press recently about that. In terms of other techniques to rejuvenate the buttocks, body lifting and the use of fat and tissue, especially in weight loss patients, has also been used to enhance the buttock region. And in this lady we can see the amount of weight loss that she has had, the amount of excess skin. And in the post-op image, which is actually taken nearly 3 years later, we can see the enhancement of the buttocks that's been achieved by the lower body lift that has been performed. This is a much more extensive operation than fat transfer with longer recovery, but does not have the same degree of risk as associated with mega volume fat transfer. Overall, the trend for buttock rejuvenation continues. Certainly fat transfer and Brazilian butt lifting will continue to increase in popularity, but patients need to be aware that it may take more than one fat transfer or butt lift to be able to achieve results that they may wish.